So this session is dedicated to microvascular complications, and I think we will hear very interesting things as regard to the role of glucose, of course, the role of lipid abnormalities also, the role of inflammation, and we will talk about type 2 diabetes, but probably we can anticipate that we will extend what is seen in diabetes, because in fact microvascular disorders concern not only diabetes but a lot of diseases, including hypertension, insulin resistance, and so forth. So this topic is very important. And to start now, we have two speakers for the first presentation, Dr. Tomita from Japan, and Dr. Hermans, who is certainly here. And the first topic is diabetic retinopathy, molecular and clinical insights. So, Dr. Tomita.
Thank you so much for kind interaction. I'm Yohei Tomita, ophthalmologist from Japan. And I'd thank you, Dr. Fujot is not here, and the staff of the occupied member allowing me have a presentation today. I'm talking about the diabetic retinopathy, focusing on the PIPA alpha FGF21 system. And then this picture is from the laboratory I was in Boston. And I moved back to Japan, but it reminds me the sweet memory in Boston. So, diabetic retinopathy is a leading cause of vision loss for worldwide. Generally, the stages are progressed from the non-proliferative to the proliferative stages. Patient will be needed the laser treatment, and the patient will be needed the laser treatment and vitrectomy and endophthalmitis, this one. But patient will have a blind even if they have such a treatment. So we need an alternative therapy in addition to these diseases. Next slide, please. So it is said that increasing permeability and the ischemia and the neovascularizations are the pathogenesis of the diabetic retinopathy. Next, please. So diabetic macular edema and hemorrhage and the retinal detachment makes a vision loss in the DR patients. So we need to cover all the pathogenesis of these diseases. So as you know, the large clinical trial, FIELD and ACCORD, have shown that fenofibrate reduced the number of the laser therapy in DR patients and suppress the progression of DR independent on stitching. So it is approved as a therapeutic preventive drug in Australia. Fenofibrate activates PIPA alpha. It is expressed in the liver, kidney, and other tissues, including the retina. And it decreases the triglyceride and the HDL cholesterol. A lot of studies show that the fenofibrate reduces permeability by decreasing the inflammation. And this group showed that fenofibrate decreased neovascularization in the retina by decreasing VEGF, which causes the neovascularization. And our group showed that fenofibrate preserved the retinal function against ischemia by suppressing HIF1, hypoxia-induced factor 1, which is a control the VEGF. But fenofibrate has side effects for the kidney and the liver, so it is challenging to use the fenofibrate for the patient with a dysfunction of the kidney and liver. Recent years, fenofibrate is approved in Japan as a drug for the dyslipidemia. It is a selective PIPA alpha modulator and activates PIPA alpha 10,000 times more than fenofibrate. and it reduced TG and increased HDL. And it has less adverse event in liver and the kidney. So it's due to the less of off-target effects. But we didn't know the effect of a pemafibrate to the retinopathy. So we try to evaluate the impact of pemafibrate against the pathogenesis in the retina. Unfortunately, there's no good animal models which mimics the diabetic retinopathy as a human. So we divided the 4 parts and used the 4 mice model. So first of all, I use the oxygen-induced retinopathy model, which mimics the neovascularization in type 2 diabetes patients, the PDR patients. So first, we put the mice in high oxygen chamber, 75% oxygen, from P7 to P12 after bath. And then mice will return to the room air. Then we fed pemafibrate and the control drug to the mice. And at the P17, the neovascularization is occurred in the retina. So we evaluated the drug to counting the area of neovascularization in the retina. As shown in this figure, pemafibrate reduced the neovascularization than control. And this figure shows the immunohistochemistry. Pemafibrate reduced the HIF1, hypoxia-induced factor 1, and also it reduced the expression of VEGF-A in the retina. To clarify the mechanism, we measured FGF21 level in the liver and blood and the retina. FGF21 is downstream of activation of PPA-alpha. So surprisingly, pemafibrate increased FGF21 in the liver and blood, but not in the retina. So we hypothesized that pemafibrate acts on liver, not in the retina. And we found that FGF21 decreased the HIF1 in the retinal cells. So taken together, pemafibrate increased FGF21 in the liver, and FGF21 goes to the retina and suppressed angiogenesis via suppressing HIF1 and VEGF. So next slide. Oh, it's freezing, sorry. Oh. Next, I will talk about the streptozotocin-induced diabetes mouse model. We checked the retinal function. So first of all, we injected the streptozotocin into the mice to induce a type 1 diabetes. And then we usually use the electroretinography ERG to see the function of the retina, commonly used in the human and the rodent. And the OP wave shows the function of the retina. And it is reduced in the early stage of DR. So pemafibrate reduced the reduction of OP wave compared to the control. So it means pemafibrate rescue the retinal dysfunction. Then we focus the synaptophysin, which is the synaptic vesicle protein. It's abundant in the retinal neuron, and it keeps the retinal function. It is said that synaptophysin is decreased in the early stage of DR too. And the pemafibrate kept the level of synaptophysin in the retina compared to the control. And we also found that FGF21 is increasing in the liver and the retina, in the liver and the blood, not in the retina. And FGF21 kept the synaptophysin expression in the neuronal cells too. So again, we concluded that pemafibrate increased FGF21 in the liver and the blood and keep the synaptophysin level in the retina and keep the retinal function. So next I will talk about unilateral common carotid artery occlusion, which mimics the ischemia in the diabetes model. So in this model, we ligate one side of the common carotid artery to make retina ischemia and gliosis. It is said that in this mice model, OP wave is decreasing, but pemafibrate rescues the reduction of the OP wave amplitude. And this figure shows the mural glia cells, which support the photoreceptor cells. And this graph shows that pemafibrate reduced the stress of a mural glia cell. That means that pemafibrate rescues the retinal function. And also we found that FGF21 was increasing in liver and blood, not in the retina. So again, pemafibrate increases FGF21 and it affects the retina and keeps the retinal function. So next final model, ischemic reperfusion model. So we are focusing on the vascular permeability aspect in this model. So this study was almost done by Dr. Lee, who is a PhD student. And we increased the eye pressure until 100 millimeter of mercury, and it causes the vascular leakage in the retina. And we also checked the ERG to see the retinal function, and the pemafibrate keep the retinal function compared to the control. And also pemafibrate keep the mural glia cells, which supports the photoreceptor. And in terms of permeability, pemafibrate reduces the increasing permeability in the retina by decreasing HIF1 and VEGF-A, which causes a vascular permeability. And also we found that FGF21 is increasing in the blood and the liver, not in the retina. So we concluded that pemafibrate increased the FGF21 and decreased the vascular permeability by inhibiting HIF1 and VEGF. So this is a summary slide. Pemafibrate increased the FGF21 and suppressed the pathological neovascularization and ischemia and permeability, as well as keep the retinal function. And another group showed that the pemafibrate decreased vascular leakage and the inflammation and suppress the apoptosis in the retina. So, taken together, pemafibrate block the permeability, neovascularization, and the ischemia, which is the pathogenesis of DR. But you may think that is FGF21 enough? So we already checked FGF21 function in the retina too. So what is the FGF21? FGF21 is a fibroblast growth factor 21, which is one of the member of FGF. And the fasting PPAR alpha agonist and the fatty acid increase the expression of FGF21, mainly in the kidney. It is said that FGF21 prevents renal lipid accumulation and dysfunction in type 1 diabetes. And FGF21 reduces the body weight and improves the lipid profile in type 2 diabetes patient and the monkey. So now the several clinical trials is ongoing for NASH or NAFLD using the FGF21. So in terms of eye, our laboratory at Harvard Medical School previously shown that the FGF21 suppressed neovascularization in the retina by increasing adiponectin and suppress the TNF-alpha. Subsequently, we used a diabetic mice model, and we showed that FGF21 preserves the retinal function by decreasing oxidative stress and inflammation in the eye. So next we focus on the vascular permeability, which is also pathogenesis in the DR. So high VEGF causes diabetic macular edema by increasing retinal vascular leakage. This paper showed that concentration of VEGF in the vitreous with a DME patient is significantly higher than the non-DR or non-DM patients. Now, anti-VEGF therapy is widely used for the patient, but there are a lot of non-responders, and multiple injection causes cataract and glaucoma and endophthalmitis. So we need an alternative therapy besides these therapies. So first we made a new vascular permeability model and also made a quantification method. So this figure is a whole-mounted retina after injecting a VEGF. And this color-coded map shows that by the machine learning, so yellow shows a vascular leakage, and the red shows a vessel, and the blue shows a background. And we found that injecting VEGF in the vitreous makes a much higher leakage than control. And FGF21 treatment decreased the leakage compared to the control. Furthermore, we checked the FGF21 knockout mice, and it shows the higher leakage than wild type. So it means FGF21 is involved in the leakage. In addition, we found that Claudin-1 is increasing in the FGF21 administration. Claudin-1 is consists of a tight junction among the endothelial cell. It's important protein to keep the vascular permeability. So we concluded that FGF21 reduces the vascular leakage by keeping the Claudin-1. So in summary, FGF21 suppressed neovascularization too, and protected photoreceptor function, and suppressed the vascular permeability. So given that pemafibrate and FGF21 has almost same efficacy for the retinopathy, it seems to support to the idea that pemafibrate acts via FGF21. So now we are waiting for the sub-analysis of the pemafibrate, and also waiting for the analysis of the clinical trials for the long-acting FGF21. And in our laboratory, we are conducting the retrospective study for pemafibrate for the DME or DR progression. And we are also developing the new delivery system for fibrate. And now we are trying to clarify the function of FGF receptor, which is crucial for the FGF21 functionality. So to verify the mechanism from the both clinical and the basic perspective is my purpose. So now I'm moving back to Japan, and I started my laboratory at Keio University in Tokyo. And we are focusing on now pathologic myopia, which is leading cause of the Asian people, and also conducting DR, DME, people alpha-related study, and also age-related macular degeneration. So thank you for all supervisors and collaborators for my work, and thank you very much for listening. Thank you.